And welcome everybody. It's wonderful to have you with us. Not sure about you, but I managed to get out of lockdown of my house this morning and spend some time enjoying the longer days of spring just about to come with us. So I'm hoping that you're able to also start to experience that from wherever you are. I'd like to recognise the traditional custodians of the land of which I'm on today, the Darkin young people, and I'm sure that you're sitting in various places across the country or perhaps throughout New South Wales as well. And pay my respects to elders past and present. I also want to recognise the traditional custodians of the land in Dubbo, the Tabaga people of the Wiradjuri Nation. As you know, some of you may know that they went into lockdown only yesterday. And also the Gamalori, Yamalare, Warilaiwan and Yagemba nations of the Walgett community in regional New South Wales. They also just recently went into lockdown. So this is a time where people are really experiencing some challenges, particularly the Aboriginal and Torres Strait Islander community in regional New South Wales. And we really want to honour and pay our respects to them and be thinking of them through this challenging time. COVID-19 is really taking hold. I remember when we were doing these presentations in different forums, and we've been in a range of lockdown or restrictions for a considerable period of time. Really since February last year, it really started to take a hold of Australia. And those pressures and challenges, people are experiencing them in different ways. Housing prices in particular have really shot up, and it's forced a lot of people that would otherwise be in a home, out of a home and homeless. The census was only conducted a couple of days ago, and we're expecting that there will be an increased number of people that are challenged and experiencing homelessness in a range of different ways, whether that's on the streets or couch surfing or or too many people in one home, overcrowding in different places. So we expect that the numbers will increase. The census at the moment tells us that on any given night, 116,000 people are homeless, and we do unfortunately expect that number to increase. So what can we do about it? Well, we're advocating that we need to have more homes. The demand is certainly outstripping the supply, and it continues to do so. And so more homes for people to live in is really what it's going to take to be able to achieve that. And that's not an easy feat. That's an expensive feat, and certainly something that we advocate for the government to do. But there's also a range of other supports, early intervention supports that we can really help and wrap around people that are struggling to ensure that they don't fall into homelessness. We're here to learn more about our Mission Australia Centre that we have been delivering services at the Mission Australia Centre at Surry Hills for some time. And it's my pleasure to introduce to you our program manager, Jazic, who has been working with Mission Australia for some 21 years. She's highly credentialed, highly liked within the organisation and very effective. In fact, she won an Order of Australia several years ago for her work in homelessness. And so we're very appreciative of Diana and the work that she does. So I'm going to get out of the way and I'll hand over to Diana to tell you a little bit more about the Mission Australia Centre at Surry Hills. Welcome, Diana.
Good morning, everybody. Thank you very much for joining us today, and what a beautiful day it is today. I'd also like to acknowledge the traditional owners of the land on which I work in, and that's the Gadigal people of the Eora Nation, and pay my respects to elders past and present. As Ben mentioned, homelessness is a very problematic issue for our community, and the Mission Australia Centre has now been in operation since 2014, and it's a unique model of service where we provide holistic support across a range of areas. We focus on prevention and early intervention. We focus on supporting clients within their own homes, in their own tenancies. And the way that we do this is the diversity of the programs and services that we offer at the Mission Australia Centre at Surry Hills. We have, there's a photo of what the centre looks like. It has 6 levels and it is a service that operates 24 hours, 7 days a week. We're a very large team. We have about 38 paid staff and over 100 volunteers. And we also have partnerships with health services, which co-locates about 12 New South Wales Health Service staff on site at any given time. You might like to do the next slide. Thanks, Dan. So we have the Spectrum Crisis Accommodation. This is accommodation for homeless men. We have 32 beds within 4 units. It's a model of service where we teach our residents living skills, so cooking skills, cleaning skills. It's very much a model that focuses on a hand up and rather than a hand out. And the men that are residing there have access to multiple programs and services that are available in the Cooinda Centre. The Cooinda Centre attracts over 100 volunteers, and we divide the services into different categories. We have a number of health services on site. We partner very closely with St George Hospital. We have a general health clinic. We have a mental health clinic. We have a vaccination hub, and we have generalist counselling, therapeutic groups on site, and we also have a special needs dental clinic. We look at providing holistic support, so whatever anybody needs, it's about making sure that we have that on site, that it's available with an appropriate and timely manner, because often the opportunities that we have to work with our people are very limited, and we need to maximise on those opportunities every chance that we get. Part of our New South Wales Health services, as I mentioned, is a vaccination clinic. And part of that, we were able to recently offer the Pfizer vaccination. We have run 2 vaccination clinics, and we've administered over 110 vaccinations to clients that are living at the MAC, those that are living in outreach properties, and for staff that are working on site as well. So we were very pleased with that initiative. We also have, if you go to the next slide, thanks. So this is our dental clinic. This is again a partnership with New South Wales Health. It is a clinic that's located on site. It is the only co-located clinic of its kind anywhere in this country. Next slide, thanks, Dan. This is the Spectrum Apartments. This is where you can see our residents enjoying a meal together. As I mentioned, part of the program is that they're taught living skills. Well, sometimes it's not even taught living skills, but if they've been homeless for an extended period of time, some of those skills that they previously had were simply forgotten. Next slide, thanks, Dan. This is our Missionbeat team. Missionbeat came under the umbrella of the Mission Australia Centre a couple of years ago. The service model, excuse me, has changed dramatically, where now the model involves very purposeful and meaningful intervention, interaction and transportation with and work with rough sleepers. We've had some great outcomes where the continuum of care has allowed rough sleepers to access our health services on site, and certainly a number of those rough sleepers were also part of our vaccination clinic. They've then moved on to our Spectrum Apartments. Some have gained employment, have gone on to their own independent accommodation. And one of those is just now waiting to be moved over into one of the 9 affordable housing units that the Mission Australia Centre also has on site. So having the Missionbeat team based at the Mission Australia has opened the door and opportunities to a particularly vulnerable group of people to access vital supports and accommodation. Next slide. Okay, one of the programs that we provide at the Mission Australia Centre is the Cooinda University program. It's delivered in partnership with the Australian Catholic University, where we offer subjects in the humanities, and once a person completes 4 units of study, they get a certificate in liberal arts, and it's a further pathway to undergraduate studies at university. During COVID, this course is now going to be delivered via Zoom, and we commence the next Catalyst unit of study today, this afternoon at 3 o'clock. We have quite a number of our former students at various universities around the country, and one that graduated last year is also studying law at the Australian Catholic University. The subjects are around the humanities, so ethics, literature, and it's about, once I was asked, why would you offer a homeless person a university course? It's about the ability for them to reflect on their own life, to further their own education, to find their life, their place in the world. And, one of the students once said to me, now when I catch up with Dad, he doesn't ask me, well, have you stopped taking the drugs, son? He says to me, how's your university course going? So it's very empowering. It's very much improving their self-esteem and confidence. And we are the only Mission Australia site that continues to deliver this program. Next slide. Thanks, Dan. Another program we have is Creative Youth Initiatives. It's a music and art program for young people aged 16 to 24 years of age. We run 2 main programs, and that's a music program where the students after a 20-week semester receive a Certificate 2 in music, and the art students receive a Certificate 3 in art design. They're both courses that have TAFE accreditation. Our young people struggle with severe and chronic issues. 90% of them have either a diagnosed or yet to be diagnosed mental health issue, or are living at home with parents with serious mental health issues. This gives them an opportunity to gain education, to increase their self-esteem and confidence, and the arts work very much as an active agent of change for our young and vulnerable people. The course has now, semester 2 commenced a couple of weeks ago, also via Zoom for our young people. I would just like to touch at the end around COVID and how challenging that has been for us. We have continued to deliver services since February of 2020 under very difficult circumstances. Ben has touched on the fact that we need more accommodation for certain people, and certainly that is the case now more so than ever. With the increased New South Wales health restrictions, it has meant for us on the service level, we have had to reduce our residential numbers to comply with social distancing requirements. We have had to decrease the numbers of people within community that are coming to the service to access programs or activities which have been absolutely vital for their well-being and helping them to sustain their tenancies and their personal circumstances. We have tried to be very innovating in delivering counselling over the phone or Zoom sessions. Our clinical services are also happening via Zoom and phone connection. We have started some sessions on site, but with very COVID-safe practices. Missionbeat likewise has continued to service the most vulnerable people in our community. It has also meant that our numbers have been reduced in how many people we're able to transport in our vans. We have, I'm very proud to say, we have some very effective COVID-safe practices within all our programs and services. We had an infection control audit back in March and we scored almost 95%. We had a New South Wales Health audit late last year and they said that our COVID safe practices were better than what they have seen in many health services. And also last year, during this difficult and challenging time, we also had accreditation and 3 of our services achieved ACES accreditation, and that was Missionbeat, the drug and alcohol program, and the inner city homelessness service. That accreditation was achieved with absolutely no requirement for any improvements whatsoever, and considering everything that was going on, I think that was a pretty remarkable achievement. Our clients have not coped as well. As I mentioned earlier, we've seen increased, as I mentioned, drug use, increased mental health issues. We try to support them as best as we can. And a couple of weeks ago, I met with residents on a Sunday afternoon. And afterwards, they told the team, well, she came. We couldn't believe she came in on a Sunday and we bombarded her with requests. We didn't think she'd come and provide any of them, but we're so happy she did. So some of those requests that we were able to accommodate was we bought a table tennis table. We organised a pizza night for the men. We have organised Wi-Fi connection and purchased additional televisions for them up on the floors so that they're able to do more activity on their levels, considering all of the restrictions that are happening. I think I might be up with my time. And I might just finish up there. I'd like to thank you for joining in this morning, and I hope you've gained some insight into the wonderful work that we do at the Missionbeat Centre, Surry Hills. Thank you.
Diana, it's Greg. I have some questions for you, if you don't mind, from some of the people on the call.
Yes.
The first question is, you mentioned you've been with Mission Australia a long time. Have you seen the reasons for homelessness change in that time with the clients that present to you?
Yes, look, when I came to Mission, I came 21 years ago for 12 months, and here I am 21 years later. And some of the changes that I've seen over the years has been that the complexity of the client need has increased so dramatically. Initially, what I was seeing is a lot of homeless men with predominantly alcohol issues. Over the years, that has changed to dependence on other drugs. It's also resulted in increased health issues, cardiovascular issues, increased hepatitis, diabetes. We used to talk about that homeless people had 2 issues that they were dealing with: homelessness and usually alcohol dependence. Now it's a myriad of issues that they're faced with, and that's why we have had to move with those needs and ensure that we provide the programs and services on site that can meet those needs. But what's also very important is that it has to be done within a very trusting environment where trusting relationships developed over a period of time. So the need has changed and increased dramatically.
Cool. The second question I have is, although you mentioned you've had to reduce the numbers of clients you can physically face, are you seeing a demand increase for people? So is there a need being unmet?
Yes, absolutely. What we're finding now is that there are a lot of people that are rough sleeping that need to, where there is an unmet need. We are trying the best that we can. We're working together with government to move them into temporary accommodation and to provide case management, provide support for them within that temporary accommodation as best as we can. What we're seeing as well, out on the streets is that a lot of the food vans are closing down, so people don't have access to foods on the street as well. You know, we're also seeing that, you know, clients that were normally coming into our Services Today programs are struggling as well. We're trying to maintain phone contact with them, trying to maintain some sort of contact as best as we can, but certainly the numbers are increasing, and the intensity of the support that's needed is increasing.
Speaking of support, could you just talk about the court support program for a moment that you operate?
Yes, I will talk about that. I forgot about that. You know, sometimes I have to think, my gosh, have I covered off on all the programs and services? We do provide a court support program for victims of crime. It's New South Wales Health funding. We deliver support in all of the courts within the Greater Sydney metropolitan areas, Supreme District, local and coroners courts. It's one paid worker and a team of 12 qualified volunteers. We have a permanent presence 1 day a week at Burwood Court, which was a pilot some years ago. And we were invited in February of last year to set up a pilot at Waverley Court every Monday, and that pilot has continued, but of course, you know, at varying levels during the pandemic. Over the course of the last financial year, we assisted 558 primary and secondary victims of crime, involving over 2,000 hours of support. Those victims, 70% of them were in court due to sexual assault issues, and 89% of them came from a vulnerable background. All of the MAC programs and services are very closely interlinked. So whilst court support sits somewhat separately, as it is not directly a homeless service, we have had still some of our clients refer to the court support service for support, and a number of the court support volunteers have moved over from court support to other parts of the business where they're now providing counselling support and co-facilitating our many therapeutic groups. So that's the court support program.
Cool. I have a couple of questions here, but it might help if Ben jumps back on the line to help answer those as well. So what similar supports are available for women? And there's also a note attached to that message that says a big thanks for all you do above and beyond.
Thank you.
I'm happy to answer the question about in regards to women. We also provide similar supports for women. There are times where it's helpful to have gender-specific services. There's a range of different supports and appropriateness in regards to that in terms of residential facilities and the closeness of communal living, just to protect people and provide the care that's required. We have a range of different services that are both male and female. It's similar types of services. We have Ebbs House is a good example in Brookvale, where we run a similar type of service for those people that are homeless and provide temporary accommodation for them. We also run a range of family and domestic violence programs, and a lot of the services are shelters specific for women and children. And there's a range of those services that we run throughout the country.
Ben, could I just interject there as well? I know I focused on the male population, and our crisis accommodation is only for males, but our Cooinda Centre day program area is open to women, and 30% of those attending our programs and services are women. And our affordable housing is occupied fairly much 50-50 split with male and female tenants. So it certainly, whilst the crisis residential section is only men, all of our other programs and services are open to women, and we have a high attendance of women also.
Cool. And I think we've got time for one last question, and it's probably one for Ben. What is the best way individuals can pressure those who make decisions in government to address homelessness numbers and the obvious need for more accommodation for these people? We magically accommodated people during the first COVID lockdown last year, but there's been no mention this year. With the federal election coming up, what can we practically and realistically do?
That is a fabulous question, and thank you for asking that, because this is an all of community challenge. It was quite magical that the state government was able to really engage with hotels and to be able to accommodate the homeless. A range of different impacts that resulted in, but overwhelmingly it provided much needed housing for people that were really suffering. Education, informing is key. I'm looking forward to the census data that I think is going to illuminate the need and how much that has grown in the recent reports. When I say looking forward to it, I'm looking forward to having the data to be able to evidence what I think we are seeing. Obviously not looking forward to the spike in numbers. But education is, I think, is what's really important for the government. We've also done research papers over the years, and Diana would know this quite well. We did some housing first research, which was able to evidence that when we put somebody in a home first and then provide the wraparound supports, that there is a savings to government on what they would be spending if that wasn't done in a range of different areas, whether that's employment, crime, or health. And so continuing to invest in research to evidence the fact that the government's dollar can go a lot further and have a greater impact when we put somebody in a home soon. But magnifying the need that the supply is outstripping the demand and evidencing that is really key for the government to get on board. We know that in other places across the world, in other areas, Portugal is a good example, where they have really focused a lot on this housing first approach, and they are seeing the benefits from that from an economical point of view. So we continue to lobby and advocate for that. So while we're doing that in the macro, we are dealing with every individual that comes into our care. And as Diana explained to you, there's a range of different supports that we are providing for the individual. And I'd also like to express my appreciation for those people that continue to give generously to be able to give to the work that we are doing, as Diana explained. I'll stop there just in case there's any other questions before I wrap up, Greg.
There is one, and it's worth asking for Diana. Do you have a wish list of things you'd like to do that funding doesn't enable you because there's no money or no interest from government?
There's always a wish list. It's an endless wish list. Certainly, I believe that the model that we have at the Mission Australia Centre works and works very well. And if we could duplicate that, and I know Mission Australia has worked very hard in achieving that in a number of locations. I think it would be, very important to have more housing for our people as well. And the wish list is never ending. Look, I would just like to also say that, if there is goodwill and commitment, anything can be achieved. And I've seen that particularly with our health services. Ben talked about research. Part of our partnership with St George Hospital is that we did research around our health clinics. We had a paper published in the Medical Journal of Australia, which was quite an achievement. We used that research paper to leverage further with New South Wales Health, and last year the first Department of Homelessness Health anywhere in this country was established under the auspice of St George Hospital. That was through a great deal of determination, goodwill, ensuring that we have the rigorous and robust data and research behind us. And I guess one simple way that we could all start in that area is having those conversations at home with our families to think about those tonight that won't have a home, that may be sleeping out on the streets, who will be challenged to find, to have access to food as well. I think if we start those conversations, increase that awareness, that will all go a long way with being able to influence community, corporate and the government sector.
Thank you, Diana and Greg. I think that may be the end of the questions. Have I understood that right?
Yep.
Great. Wonderful presentation, Diana. Thank you. And I also appreciate those questions. I'd like to add, I'd like to continue to get behind what Diana was saying. And if you do want to advocate, if you do want to be part of the voice to really shine a light on the needs for homeless, there is two ways that you can do that. There is Everybody's Home advocacy campaign, and you can look that up. It's an easy one to find, and you could Google Everybody's Home, and there's an opportunity where you can link into that to be able to share your voice. And if you're in Queensland, there's the Town of Nowhere campaign, and they're campaigns that really does get behind what I was saying before in terms of being able to magnify or shine a light on the needs so that the government may be able to continue to respond in a way that can support those people that are really in need. So I'd like to finish by thanking you, Diana. Thank you for your 21 years of ongoing service. We really appreciate what you're doing with the team. And also like to appreciate those people that are generous supporters. Without your support, we would not be able to provide the help that we do to those people that are really doing it tough. And we know that most of us can potentially be only a couple of paychecks away from being in that situation ourselves. We are all vulnerable. We're all susceptible to it. We all just happen to have lived different lives and different circumstances hit us in different times. And so your generous support for those people to help them out of the plight of homelessness is greatly appreciated. I wish you all a wonderful end of winter day, and I hope we are all looking forward to spring coming. Thanks, everyone. Have a wonderful day. I'll see you later. Bye-bye.
Bye-bye. Thank you.